You're watching CTOM TV. Knowledge is power.
Why do children get cancer? They don't have bad lifestyles.
No, they don't.
No,
Typically, they don't, or they don't have a chance for it to catch
Maybe
up.
a little too much sugar sometimes, but not enough to warrant that. No.
No, when a child gets cancer, when anyone gets cancer under the age of 50, it's because they've inherited a genetic mutation that is causing sensitivity to certain carcinogens or is creating damage within their bodies.
So
that's always the case.
So it's an inherited mutation. And what can be done for those inherited mutations?
Well, you have to know what they are.
Okay. How do I find out what they are?
You do genetic testing.
Okay.
You do tumor-based testing, and you probably want to do inherited-based testing too.
Right.
Germline testing.
Cover all the bases.
Yeah,
there, because
exactly.
those are two different things.
Yes.
Yes.
Okay. And then obviously, if it's a child, things can happen very fast. So you want to do a liquid biopsy-based test for emerging mutations too.
Right.
So touch all three bases.
Right. But the point is there are three bases now. It's the old days of just standard chemotherapy and radiation are gone. There's lots of options.
Yes.
But as you were saying, you have to have that genetic testing to find out
need that, yes.
what the options are.
Yeah.
But the answer to your question, Hilda, is almost certainly because there's some sort of mutation that they've inherited.
Yeah. Now, I think it's important to understand, currently the genetics in the medical system, they look at inherited mutations as germline only. They don't consider inherited what we call somatic mutations. And it's quite interesting because, when I was studying medical genetics, we learned all about these mechanisms. And for example, with Down syndrome and Reye's syndrome, that causes, mental retardation. With those diseases, what happens is a certain egg will have damage in the glue that separates the chromosomes. And so the chromosomes will have unequal crossover, and one cell will get more of one chromosome or less of a chromosome, or chromosomes will stick together, and you get these syndromes, Down syndrome and Reye's syndrome, which are additional or altered balances of chromosomes. Well, this also causes cancers. So this process is actually very common in cancers. We see this all the time. If you look at a cancer cell under a microscope, you can see just messed up chromosomes. I've looked at HeLa cells that have had like 100 chromosomes.
Wow.
So, you can see a lot of changes in the chromosomes. So often it's, what we call, the bad egg or the bad sperm, where it's just an unlucky circumstance. So what that means is it's not going to be a germline mutation. It's not going to be something you can track back to the parents and say, well, there's a lot of, cancer in this family, or, we don't know why your son has cancer at 8 years old, even though, you have no cancer in your family.
Right.
So obviously it is genetic. Otherwise, come on, seriously. It's just located to that one egg. It's not a germline mutation. It's a inherited somatic mutation. And inherited somatic, for some reason, is being ignored in cancer these days. They still refer to it. Well, a lot of people just don't put that together, and I don't get why.
Well, the important thing is
we're all taught this.
Yeah.
It just hasn't been really emphasized.
Well, there are, I hear you talk so often about all the variables that need to be considered when, when you're trying to design a treatment plan for somebody, or, make sure that they're getting the right care.
Yeah.
When you think of how many, the 15 minutes that your oncologist has to spend with you and come up with your treatment plan in your first visit, really doesn't allow for all these extra things to be considered, frankly.
Thank you for watching CTOM TV. Subscribe below and stay informed.